This is Richard Simelka. Today I want to talk to you about the subject of the web of interconnection in both health and disease. So I think over recent years it has been emphasized that all of our different organ systems are actually closely interrelated and in close communication. And in the recent couple of years, the axis between the brain, the central nervous system, and the GI tract, the gastrointestinal, the digestive tract, has been emphasized, as has the relationship between the digestive tract and the skin. The reality is that our entire body is a web of interconnections which are critical to maintain our health. Now, unfortunately, at the same time, there is a web of interconnection of diseases that can result both in acute and terrible situations, but also in chronic disease. And this is something that I've progressively more discussed and reported on in these presentations. And I have used in the past, and it is one of my favorite sayings, abyssus, abyssum invocat, which in Latin, and it translates into one hell calls forth another. And I've used that to describe the fact that when you have an immune dysregulation condition, then it predisposes to get more immune system dysregulations. So classically, I've described if you have an autoimmune disease like autoimmune thyroiditis, you're at risk for developing gadolinium deposition disease, which I'll call GDD. Similarly, if you have other autoimmune conditions, cytokine release storm, and so on, you're predisposed to get others. And one of the more important ones, I think, that have developed regarding GDD is the association between mast cell activation syndrome, MCAS, and GDD. Now, unfortunately, I wanted to report a more recent description of the interconnection between chronic syndromes, chronic diseases, and chronic infiltrations that we have. And that is the New Jersey Institute of Technology has recently described that plastic nanoparticles can absorb heavy metals. So heavy metals of all kinds. So they describe lead and cadmium and others, but this of course would also apply to gadolinium. So as I've mentioned before in prior presentations, that amongst all of the pollutants that we now accumulate in our body, and just to name a few, PFAs, pesticides, and nanoplastics, and of course the full range of heavy metals, of all of them, the only that can be directly treated, and the best treatment for most things, if it can be achieved, is direct removal, is heavy metals and chelation. Now, I think in an earlier presentation I mentioned that further work needs to be developed to create optimal chelators for various other heavy metals that we experience in our body. So right now, DTPA is quite outstanding for both gadolinium and lead, and that's what I recommend for both, because it of two properties: the intrinsic high log stability constant and the fact that it's demonstrable that it works in vivo in humans. And to do that, we use 24-hour urines pre and post chelation, looking at heavy metals. So when we think of, well, now you're telling me that the nanoplastics I have in my body is also absorbing heavy metals, including gadolinium, and oh my God, what am I going to do? Well, let's get back to the basics that I have mentioned for some time now. We start with trying to calm down, because all of these conditions result in damaging cytokine release, which includes stress. So as much as possible, when we think, and sometimes, and I understand this, it's easier said than done. Yes, of course it is, but it also doesn't mean it doesn't have to be done. So managing our stress is so critical in dealing with all of these chronic conditions that can afflict us. So we reduce our stress. We improve our diet. We try to minimize the amount of ultra-refined foods we get. We do moderate exercise. Remember, too little exercise is not good, but I think also for most people, too much exercise doesn't really help them, and I think in fact may harm people, unless you're doing it for some sort of natural endorphin release, and I can understand that. But you have to have moderate exercise. Then from there, what we can do is we can get, and this has been my focus, we can get gadolinium out of your body, and at the same time, it's optimal for lead. And I've described in earlier presentations, and I'll repeat that again in upcoming presentations, on how we know we should be getting chelation and how to judge when the end point is. So thank you for your attention.